The case being presented today is a 44-year-old female that presents to the clinic with chief complaint of cottage cheese-like discharge and itching. She presents with possible yeast infection. She states that 1 week ago, she started noticing some cottage cheese-like discharge with itching, and she notes that there's some odor. She reports that she only has sex with her husband and they are sexually active. She states she has no new feminine hygiene products, hasn't changed her detergent or any household items, so there's nothing new. The only thing that she reports to me is that she was on antibiotics about 2 weeks ago for her severe sinus infection. Her pain rating, she really doesn't have a pain rating, she said. She just is it's discomforting, and she's just uncomfortable and concerned about the slight odor that she notes. She reports her last menstrual period was on 10/10/18. This patient is para 3, gravida 3. Her last pap smear was on 8/20 of this year, 2018, and the results were normal. She has no past medical history other than a couple UTIs. She doesn't take any current medications. She has no known allergies. Her surgical history, she had 2 C-sections with her last 2 kids in 2004 and 2006. For review of systems, these are all within normal limits. No weight change, fevers, chills, no respiratory symptoms, nice shortness of breath, denies chest pain, denies any urinary frequency or burning other than the discharge noted that we discussed. This patient is 155 pounds. Her height is 5'7". This puts her BMI at 24.3, which is normal. She's answering all questions appropriately. Lungs are clear, regular, movement is symmetrical, heart rate is normal, regular rate. There's no murmurs noted upon auscultation. As in regards to the vaginal exam, no pain or any concerns with palpation on bladder. The urethra and meatus are unremarkable. When we're doing the vaginal exam, it's noted that she's got a moderate amount of white discharge in her vagina. The cervix is pink, normal in appearance. There is just the white discharge seen throughout. Upon palpation, there's no cervical motion tenderness, there's no adnexal masses palpated, and otherwise unremarkable other than the complaint of the white discharge with moderate amount. So diagnosis for this patient is going to be candidiasis of the vagina. Differential diagnosis for this patient is going to be trichomonas vulvovaginitis and possibly nonspecific vaginitis. My zebra diagnosis was difficult, but I came up with lobomycosis, which is also a form of fungal. So let's talk about what is yeast. Obviously, yeast is fungal. We have normal flora all throughout our body. It sits and stays, and it's in mostly homeostasis for the most part. But however, sometimes, as you'll see in this picture, if there's any disturbance, as in not enough good bacteria, it gives room for the candida to grow. Most of the time it is a localized infection, however, sometimes it can be systemic. Yeast infections are the second most common cause of vaginal infections, first being bacterial vaginal infections. The risk factors for this, for the yeast infection, can be diabetes mellitus, can be obviously if someone's immunocompromised, as we discussed with this patient, any person that's on antibiotic therapy, you're going to knock out all the good flora and give room for the bad flora to grow. Pregnant people can also be susceptible to this, and people on certain birth controls. Some important facts to note about candida. There is an overload of conflicting information, mostly ineffective advice when it comes to this. It's not just women. Men, baby, children can also have yeast infections, and they vary from person to person. Certain drugs, creams, or probiotics cannot cure the candida infection. And it's not a myth. It can be a serious harm to the body if left untreated. It has different growth stages, and it varies symptom to symptom on the person to person. Most important fact of the day: sex does not cause a yeast infection. So the plan for this patient, obviously we're going to treat for the candidiasis. We're also going to test for the candida, the trichomonas, and the gardnerella. I am going to treat this patient with the diflucan one-time dose of 150 milligrams PO. Education is going to be key for this patient. The vaginal care, you want to recommend a mild soap, hygienically to clean with. They are not to absolutely any necessary means douche or introduce any other kind of form to the vagina. Refraining from sex during this time, and if the husband has any symptoms or whatnot, he needs to follow up with the primary to be treated as well, because it can be passed through intercourse. Cotton underwear is key to wear while having this infection. It just makes it more comfortable for the patient. And there are certain foods to avoid if you're experiencing a yeast infection. Sugar being the number one key. Sugar feeds yeast in any form matters. So if someone has a high sugar diet, they eat treats all day, they snack a lot on candies, they drink a lot of soda or sugar containing products, you really want to encourage them to stay away from that kind of stuff. It's just not good. Another thing to educate the patient on if she were to develop these kind of symptoms, because often when a woman develops yeast infections for the first time, the next time she's going to know immediately what it is. Then the first time they're kind of caught off guard and just don't know what's going on and why they have this discharge, and then I haven't been with anybody else, is it an STD? You just want to reassure them and look for signs. They'll know the next time. There are over-the-counter monostats, and I wish I had bought one, but I didn't buy one. Monostat is a normal one. It comes in, there are 7 days, there are 3 days, and there are 1-day treatments that you can do. And essentially it's the Teconazole ointment, 6.5% for the 1 day. And as I said, there are 3 and 5 days. So for future reference for your patient, if they start developing these symptoms early on, try those for sure. This patient's been well over a week with these symptoms, so I feel like diflucan is the best. I want this patient to return to the clinic in 1 to 2 weeks just to check and make sure all symptoms have resolved. I want them to call if there are any questions whatsoever to our office, and either the nurse or I will call with results of all the testing, and if any of the testing is different or not what we thought with our original plan, we will change that plan and address those issues and treat as needed. And that's it. Thank you.